Thanks so much for joining our presentation today. Today we're going to talk a little bit about what to kind of expect in 2017, what we can look forward to, what we're kind of predicting, what we can plan for, and how we can profit from some of the areas in 2017. So we know that with 2017 brings a year of uncertainty since we don't know where the ACA and all that healthcare is going towards, and it also provides us with many opportunities. So the ACA fate remains unclear. New technology will challenge healthcare and how we deliver healthcare. Drug companies and the relationship with Washington and consumers may undergo changes, and the shift toward the value-based healthcare is continuing to develop and alter how our patients are cared for. So as the healthcare industry, we will continue to grow, and there's many opportunities that we are going to see. So when President-elect Trump is inaugurated tomorrow, January 20th, Republicans will control both the legislative and the executive branches of government, and this will be the first time that happens in more than 10 years. The new Congress has definitely made it clear that they will repeal and replace the Affordable Care Act, and recently Congress has already taken its first step and introduced a budget resolution which instructed congressional committees to develop ACA repeal legislation. So as 2017 moves forward, we will still need to continue to watch and gather more information on that, as this repeal and replace will actually eliminate health insurance exchanges and may reverse the expansion of Medicaid and adding 20 million people back to the uninsured status, depending on how the Congress moves forward with this. Pharmaceutical industries, in 2016, we saw a lot of highlights through them, price hacking scandals, mergers, acquisitions, and vaccine research and development for diseases like Zika and Ebola we saw in 2016. And we can expect a continued push to markets for more growth with the pharmaceutical industry, and Trump has promised to bring down drug prices. But again, we still have no policy or regulation to understand what will be put in place. So 2017 is a big year to watch the pharmaceutical companies as well. Tom Price is Trump's pick for the top position of Health and Human Services. And if he is confirmed, he's going to be the first physician secretary of Health and Human Services since the Bush administration. And we've heard that Price has been a critic of government involvement in the patient-physician relationship, and has also indicated that price transparency along with reducing drug costs will need to be a top priority for him. So we may see pricing restrictions. We'll definitely start to see more transparency from the pharmaceutical industry as it tries to rebuild that trust with consumers and physicians as well as insurers. Again, we're still unclear on what policies will take place, but we'll continue to watch this unfold and make information known to all of you. So in 2017, practices are going to need to adapt, innovate, and build new programs and approaches for care delivery. MACRA and MIPS will bring practices needs to adapt to the value-based payment initiative by focusing on more quality initiatives, advancing care information, and practice improvement activities. These all will lead to lower costs and higher rates of healthy patient outcomes. Quality metrics data will also be shared publicly on the Physician Compare website. So it's really important to focus on that quality data and how we're treating our patients. So with MACRA that took effect on January 1st, most providers will be participating in the new quality reporting track of the QPP, which is MIPS. So MIPS replaces the PQRS, meaningful use, and it combines it all into one program now. And this is in the first year of MIPS, the physician performance will be compared with 3 categories: the quality, advancing care information, and practice improvement activities. 2017 is also a transition year, which allows practices to potentially receive incentive payments for reporting data for a full 90-day consecutive period or for a full year. And Care Optimize is developing tools to help practices reach that full year reporting mechanism. So practices are also able to avoid penalties by reporting just a small amount of data as well, such as one quality measure for one patient. But again, we are working on tools and going to give you tools to help you reach that full year potential that can lead to maximum incentive payments and possible bonus dollars, depending on how well you do. So practices can innovate by focusing on improving health information technology, usability, and interoperability, such as like telemedicine, cloud-based solutions. These create effective and secure data sharing. Practices can also build on the care management aspect. So chronic care management will continue to expand Medicare patients for care management services in 2017, and face-to-face visits are now limited to new patients or patients that have not been seen in the past year instead of every beneficiary. Practices can also research new initiatives such as Comprehensive Primary Care Initiative, or CPC, and that's a 4-year multi-payer initiative which strengthens primary care, and it also helps bring in additional revenue for practices. NCQA PCMH is another area that practices can explore. Since participants in this program are certified patient-centered medical homes, earn full credit for the MIPS improvement activity category. So NCQA also provides a program for specialty practice as well as primary care. So that's definitely something that people would want to investigate further. In 2017, there's been more focus on wellness for patients, and in 2017, both public and private sectors are expected to move forward with new standards and initiatives that help increase the use of administrative transactions. We expect to see regulations from CMS this year that will establish standards for electronic attachments that will aid in simplifying the process of claim submission and requests for both health information and medical records. One of the ways that you want to make sure that you are going about and getting ready for all this new technology is to review each area and business unit, as well as the different locations that your practices may have. You want to ensure that all your systems are equal, and this will help prevent hackers targeting our systems. We want to create a dedicated group that keeps processes and projects up to date. So if we're looking into all the different areas for quality and the advancing care opportunities, create a dedicated group that's in charge of those areas and can keep the project rolling along and meet with providers and meet with clinical team members, as well as billing and front desk staff members to make sure that everybody's aware of the project and discuss how each area actually is a participant in the whole progress. Consider all the new technology offerings and apply and coordinate them with services that you deliver to your patients. So a lot of rural health communities have looked into and started the telemedicine option just because it's an easier way to see many patients that don't have access to maybe car services, or they live far away. They can provide some health care that way. And be prepared to compete with all the technology and financial services, and invest in cybersecurity to avoid all the costly breaches that we've read about in 2016. So as technology advances, telemedicine again becomes more affordable and it's more accessible. Expectation for more convenient care and the unavailability of many primary care providers has also led to a rise in the telemedicine companies. Telemedicine as well as mobile health apps that are available are becoming more and more consumer friendly, and more patients are starting to use all this technology to monitor and track their health. So like Fitbits, home workout sites, MyFitnessPal, and many, many other apps are bringing ways for patients to actually be in charge and monitor and track all their health and what they're doing each day. So at this point, I'm going to turn it over to Jonathan, and he's going to go over that offering I was talking about that Care Optimize is developing to help practices reach that full year submission, which can lead to higher reimbursement and bonus money.
Yeah, thanks, Christina. So real quick, I want to, and Christina, if you wouldn't mind going back to the presentation.
Oh, sure. No problem.
Yep, and I do not have access. If you could just go through the slides for me, that'd be great. So on this next slide, you'll see is a screenshot from what we have developed, which is our MIPS Dashboard or our MIPS management solution. And this tool is not dependent on your EHR. So the reason this was created is we have a lot of clients that said we don't want to be completely dependent on our EHR for quality reporting. We want to be able, to run cleaner reports, to look at provider versus provider, to be able to attest, to be able, to choose more than just a standard 50 set of measures. What if we could look at all 243 quality measures? And can we do things that we can't currently in our EHR, like automatically send reports out via email to each of our physician and staff so we can compare and see who is scoring well in which areas. Christine, if you go to the next slide for me.
Yep.
Perfect. So what you're looking at here is a shot of the dashboard, and this MIPS dashboard takes us about 3 weeks to set up for a practice, and it is all in real time. So in this case, we're looking at a practice view where we can see that their quality scores, they're at a 40 out of 70, their cost at just about 16 out of 20, and then we'll also show their ACI and improvement activity scores. And each of these you can drill down into at the practice or provider level. So if you were to click on quality, that would take us to the next slide. Christina, if you could show the next slide.
Yeah.
You're going to see the measures that were selected by this physician or this practice. You have a choice. You can report both at the physician or at the practice level. And here you can see how they're scoring in each of their primary measure sets. So these dashboards will exist for each practice and each provider for the quality, the cost, the ACI, and the improvement activity sections. Again, this is a web-based tool that we have developed that you don't even have to do within your EHR system. This does it completely outside for you, and we pull all of the necessary data that's required. Logins are available for as many physicians, as many staff as you want to have access to it to monitor. We also, if you notice the little white lines right in the middle of the first green horizontal bar, that is the CMS benchmark. So we have put benchmarks in every measure so that you can see where you stand against CMS's measures, so that you know if you're scoring well or you need to improve in certain measures. If you go to the next slide for me, please. Perfect. Now, these are two slides that I've put together. Let's say that you wanted to see a patient view of perhaps why a provider wasn't scoring well in a certain quality measure. It's going to pull up this screen on the left showing you each patient and how many care gaps are attributing to that low score. So if you were to click on the first patient there, it's going to pull up the bottom right screen. So patient Mary Ellis, I can see that under my quality scores for this physician, there's a breast cancer screening, a colorectal screening, and it looks like the diabetes A1C was greater than 9. So I can see that those 3 care gaps need to be reined in to increase that score. So not only are we showing you what the score is, but what needs to be done to increase that provider's score. Next slide. And perfect. And then this slide here, this is the final slide I'm going to show you today, and this is a view of all of your physicians. So I have organized our physicians by the lowest score to the highest score, and in this case, I can see, my physicians there at the top have the lowest MIPS scores. This is all drillable, so once I open those up, I'm able to see where they stand on each of the 4 categories, and then in each category with their specific measures so that I can address them. Finally, if you click once more, Christina, there should be an image of a scorecard, and this is automatically emailed however often you would like to whoever you would like on your team, physicians, staff members, and this will allow them to see each of the 4 categories for each physician and where they currently stand with their MIPS score. So this is actually live. This tool we have already got up and running, and if you would like more information on it, we do demos one-on-one of these every day for our clients, and we would be more than happy, to run through it with you and look at your specific measures and see what needs you may have. If you go to the last slide for me, please, Christina, we'll leave you with our contact information. Again, everything we've talked about will be on our website at careoptimize.com. This recording will also be on our website and on our YouTube page, also on our LinkedIn page. The number there at the bottom, you can always reach us. Again, if you have any questions about today, with any of the topics Christina went over in more depth, she would be happy to have a conversation with you. And again, with the MIPS dashboard, over the last 2 weeks, that has probably been the most common question we get is, I want to qualify for my highest bonus. I want the 3 times multiplier for the first year. I want to set my practice up to make sure for subsequent years we are already prepared and we're not competing against folks who just try to scrape by the first year. Again, as everyone knows, you versus your peers for your bonus payments in MIPS, so a little bit different mindset for most practices to think about. Again, if you have any questions, please let us know. You can always reach us by visiting the website or calling us at that number. And that is all that I have today. Jan, anything else on your side?
No, I think you took care of everything. Thanks.
Perfect. Thank you.
And thank everybody. Thank you for coming, everybody. And as Jonathan said, the recording of this webinar will be available within probably about 24 hours. Thanks for coming. Bye-bye.